biomechanics would not be good. So it's good to use some pillows for your shoulder, frozen shoulder patient. What is that? Because your patient usually have some faulty posture like a hypokyphosis and then the rounded shoulder and etc. Right? So then it's good to use some pillows to support their shoulder area. And then I already treated the compensation site, let's say, and then we're gonna move on to the affected side now. So like a general techniques that you're gonna use for your patient for a neck and shoulder, all the muscle, that would be okay. I'm gonna put you back. So any fascial techniques first, and then the Swedish techniques to loosen up those areas good. So I already loosen up all those areas here. And some techniques that you can use in this position is some joint mobilization technique before you flip over, right? After you loosen up all the muscles, now you feel like, oh, I'm ready to go digging more to do some joint mobilization techniques. So then what kind of the joint mobilization technique your patient need in this position? Because your patient cannot do external rotation much, right? So then you need to perform anterior glide of the GH joint in prone position, right? So before you flip over, so the anterior glide of the prone position is possible, right? So you're gonna have your patient into the position and then do it, or like if possible, then you can do into the little bit of the area here too. So anterior glide, you guys already learned how to do it, right? And then what else? So from here, you guys can perform some joint mobilization technique for the scapula area too, right? So usually your patient has a rounded shoulder, which means they have a protracted and then a little bit sometimes upward position, depending on how bad is the position. So then where you need to place the scapula is more like medial glide or the inferior glide, right? So then you need to perform that for your patient. So the medial glide or the inferior glide for your patient. And then you can hold the pose depending on how long your patient need for the release. And then what else you can do? So you can actually massage the subscapularis muscle in this position too. Like you can directly go to the muscle in a supine position, but also you can try to massage your patient's shoulder in this position by placing your hand on the scapula. And then it's like you're gonna try to squeeze the muscle between the shoulder blade and then their rib area here, and then rubbing it in between. So you're gonna hold your patient arm stable, like you can relax your shoulder, and then you're gonna hold their scapula, and then you're gonna move into the medial glide, and with a little bit of the lateral glide, you're gonna squeeze it in between the ribs. So with the small scapula like this, it's gonna be easier for me to hold like that way. So my 3 fingers here is gonna be holding their spine of the scapula, and the 2 fingers thumb and then the pinky is gonna be guarding the borders. So one is for the lateral border, the other one is for the medial border here, right? And then hold the scapula and bring it into the medial glide. And then you need to distract a little bit of the GH joint to here. If you pushing into it, then you're gonna create more pain for your patient, right? So while you are into the medial glide, distract the GH joint and then lateral glide a little bit in between. So you can actually massage the subscapularis muscle in direct way instead of like going directly underneath of their armpit area. And then what else? So there is a passive pendulum exercise that you can do with your patient. So then you need to ask your patient to come to the close to the edge of the table. Are you okay to come close to it? Maybe you need to slide down so you can rest your head better. Yeah, there you go. Then you need to have the shoulder joint actually out from the table. Yeah, there you go. So once your patient relax their arm here, so then you can move their shoulder joint back and forth like the exercise that I showed you. It's the same thing, just now they are not doing the motion, you are making the motion for them. So abduction and then flexion, the flexion and extension, and then abduction, adduction too. But you need to be careful that your patient doesn't hit the leg of the table here now, right? So when it comes to the abduction and adduction motion, you need to have guard them so their arm is not hitting it. And then you can make some circumduction motion too at the joint. So these are the techniques that you can do for the prone position. Now we're gonna switch your position. Let me hold the sheet first. You ready? Complete. We're gonna pull out your right arm. What you need to do in this position, you're gonna loosen up the structure for the anterior chest as well too, right? Like the pec muscles and all those. If you wanna go deep inside for the pec minor muscle, because when your patient has a rounded shoulder, which means their pec minor is got shortened, right? And then sometimes anteriorly tipped scapulas, which means their pec minor is really short. So sometimes you can go directly into the muscle to actually stretch the muscle, so massage the muscle. So then you need to go underneath of the pec major muscle, right? Go deep into the pec minor to actually massage it. Or you can perform some PNF technique for that muscle too. So you can place your hand. This one is holding the shoulder spine of the scapula. And then this hand is around the coracoid process area. And then you're gonna roll your patient into the stretched position. And now you're gonna give the thrust on the shoulder here. So you can relax now. And then you're gonna stretch further into the position. So my action, like holding here, and the coracoid process here. So you're gonna get into the further stretch, right? And then ask your patient to use the pec minor muscle to contract. And then after they get release, like contracting that for like 7 seconds, and then they're gonna let go, right? And then you're gonna roll the shoulder that way because your patient has like this, right? So that's one of the things that you can do for the pec minor, not only the just massage. And there are some like a joint mobilization technique that you can do for your patient here a lot, right? So especially the distraction and lateral gapping is the major one that you should do for the GH joint issue. So then you can perform the long distraction, right? Long axis distraction, or like lateral gapping is the major one that you have to do to make the range, right? So you're gonna do the lateral gapping too. Are you okay? And then for abduction, 90° of the inferior glide is helpful if your patient doesn't feel the pain to reach to that 90° abduction, right? So you can perform some that one depending on the availability of your patient. And what else? Oh, and then that one, rhythmic stabilization. So that's one of the PNF technique that you can use for the frozen shoulder patient. And there are two combined motion is happening. One is the external rotation with the abduction, and the other one is gonna be internal rotation with the adduction by your patient. And your hand is gonna be put some resistance while your patient are doing the motion. So this hand is gonna be holding the humerus. So it's gonna be against the abduction or the adduction. And this hand is holding the wrist area to against the external rotation or the internal rotation, right? So you're gonna have your patient into the range where your patient gets further. Like for example, she is fine like up to this here. So then I'm gonna ask her to push into this thumb and this thumb together. Like external rotation with the abduction. Abduction too. Abduction, yeah, there we go. Yeah. 3, 4, 5, and you can relax. Then the other action right away. So adduction and internal rotation. So you don't need to use like full strength, just like 20 to 25% of your strength would be enough. So I can against with my fingers only, and that's it. So let's try again. Okay. go. 2, 3, 4, 5, and the other one. 3, 2, 3, 4, 5. Once you done that set, and then you can have the rest, and then you can into the new barrier now, and you're gonna do the motion again. So your goal is going from here all the way up to the full range eventually. But you're gonna start where your patient feel the pain there. So there are two motions is happening at the same time. That's why your hand placement is one for the humerus, the other one for the forearm at the wrist area. So this hand is guarding the abduction or adduction. This hand is for the external rotation or internal rotation. It's combined action, not one or the other. So with the abduction and external rotation together with that, and then internal, and then the adduction together with that. So you don't let your patient to move into the range. So it's isometric contraction, and then isometric contraction in the other way. And next stage is here, for example, and then here, and then moving up and up and up more. Okay? That's the one of the thing that you can do. Okay.
Can we use the PNF in acute?
So
No.
depending on the where they are placing their arms, so it's kind of possible as long as it doesn't cause any pain. So you can try, like with your patient, if it is in a like a smaller range where it's close to their body, it's kind of possible. But mainly when you are using the rhythmic stabilization, you wanna increase the range, so you can target this one more in a subacute to the chronic stage instead of the acute. So in the acute stage, it may be safe to just to use the active range of motion in the joint where your patient doesn't feel the pain, or like just to joint mobilization technique grade 1 and 2 to maintain the range of motion, not this one. Passive pendulum exercise is option 2. Okay. Any other questions? You feel better now then? Okay. Okay, so then let's treat one